All right. Hello, I am Tarlise Townsend. I'm a postdoc at the Center for Opioid Epidemiology and Policy at the NYU School of Medicine. And I want to talk today about some research that my colleagues and I have been doing to look at racial disparities in Good Samaritan laws and their effects on overdose mortality. And today I'll talk about some evidence that we have obtained from Ohio and Michigan. So you may all be familiar with this at this point, but Good Samaritan laws are a pretty popular policy response to the overdose crisis. These laws exist now in pretty much every state in the country, and they aim to reduce overdose mortality by providing some limited legal immunity from low-level drug crimes for folks who call 911 at an overdose or who experience overdose when 911 is called. And the hope is that by providing these additional legal protections, people will be more likely to call 911, first responders will be more likely to come to the scene, and overdose mortality will fall. But the reality is that despite these additional protections provided by Good Samaritan laws, many people are still not calling 911 at the scene of overdose events. And there's a range of likely reasons for this. In many cases, these laws are not especially expansive, so the protections may just not be sufficient to influence people's behavior. People may not be fully aware of the protections and the nuances of the laws. And a key issue that comes up over and over again in the qualitative research on 911 calling is persistent fear and mistrust of law enforcement, even in the midst of the added protections from a Good Samaritan law. Now, given what we know about the long history and present of racist policing and drug war policies in the US, it's reasonable to hypothesize that these barriers to the effectiveness of Good Samaritan laws could be greater in Black people than they are in white people, resulting in racial disparities in the effects of Good Samaritan laws. That is to say, white people may be benefiting more from these laws than Black people. So the challenge, though, to studying this question is that these policies are enacted in the real world, right? And lots of other things are happening in the real world. So a key challenge for causal inference around the effectiveness of Good Samaritan laws is that those laws are often co-enacted with naloxone access laws. You can see in this figure on the right how GSLs and NALs are kind of moving together over time in terms of the number of states that have them. So how do you tease out then the effects of one law from the other? Similarly, these laws are often passed amidst a rise in fentanyl-related overdose. Now, if fentanyl is influencing mortality and Good Samaritan laws may be influencing mortality, again, how do you tease out the effects of each of those things separately? For the methods wonks out there, we have this problem of the parallel trends assumption often being violated. That assumption is key to a lot of our kind of common econometric strategies for evaluating the effects of policies. And finally, because so many states have enacted Good Samaritan laws by 2018, if we want to look at the effects of these laws in overdose in recent years, we run out of comparison states, right? We run out of states to compare to or control states that haven't implemented the law. So in the context of all of these challenges to causal inference, we've been thinking about how we can do a good job of studying racial disparities and the effects of GSLs. So in this study, we evaluate the impact of Good Samaritan laws on overdose mortality per population using data from the National Center for Health Statistics. And those data are from 2015 to 2019. And we look at overdose mortality in Ohio and Michigan separately, overall, and in white people specifically, and in Black people specifically. And I talk more about the methods in the methods brief, so this will really just be a general, not even an overview, but we use this method called synthetic control method, except we've added kind of a novel spin to it in order to circumvent the serious methodological challenges that I talked about on the last slide, or some of those challenges at least. And so we think that this is really an improvement on what we've been able to do in past research. So what we were doing then is comparing Ohio and Michigan, those were the enactment states. So they had naloxone access laws throughout the 2015 to 2019 time period. So nothing was changing in terms of NALs in those two states, but they gained a Good Samaritan law in the middle of that time period. And then the comparison states were actually states that had a Good Samaritan law and a naloxone access law throughout the time period. So what do Michigan and Ohio's Good Samaritan laws actually say? Well, they're pretty similar on some dimensions. Both provide protection from prosecution for low-level drug violations, but Ohio's is a little bit more expansive in the sense that it also provides protection from arrest. And you can think about how that matters. If you're going to be, that you may still be arrested after calling 911 at an overdose event, that really may be a pretty severe deterrent from calling. But neither Michigan nor Ohio protects from violations of probation or parole, and neither protects for paraphernalia possession. Ohio has two additional really important caveats. The first is that a person only receives these protections if they receive a referral for substance use disorder treatment within 30 days. And there's this two-strike caveat where they have to have, they can only have benefited from the Good Samaritan law twice in total before they stop receiving these protections. So what did we see? Well, in Michigan, interestingly, we saw no clear effect of the Good Samaritan law in the overall population, in white people, or in Black people. So really no apparent effects of the Good Samaritan law on overdose mortality in Michigan. In Ohio, the story was slightly different. We did see some decrease in overdose mortality that appeared to be attributable to enactment of the Good Samaritan law. It was about 12% in the overall population. But we only see this when we break down by race ethnicity, we only see this effect in white people. We don't see a clear effect in Black people. Now, part of that might be the N problem, right? That the sample is smaller for Black folks. So that's something that we're working on discerning. So what are our big picture takeaways here? Well, we didn't see any effects of the Good Samaritan laws in Michigan, regardless of race. This could have to do with the lack of expansiveness of the law in Michigan. Again, they only protect from prosecution. Paraphernalia is not covered. In Ohio, in contrast, we did see an apparent effect of the Good Samaritan law, but it was relatively small and it was concentrated in white people. And we can think about all the possible mechanisms that could underlie a racial disparity if indeed that's what's driving these results. Again, Black people may be even less trusting of police involvement at an overdose scene than white people. They may be less covered by the law. If you think about the fact that Black people have been disproportionately criminalized in the drug war and through so many other processes in the United States, and the fact that many of these Good Samaritan laws don't protect you if you have an outstanding warrant. Well, if Black people are more likely to have an outstanding warrant because of disproportionate criminalization, they may on average be less covered by the Good Samaritan law. There could also be differences in familiarity with the law by race. So these are all important things to explore moving forward. But I think the bigger picture here that we need to be aware of is policies, laws, they're not enacted in a vacuum. Right? We live in a racist society. And so when these laws are enacted and embedded in racist structures, racist institutions, racist cultures, we can't expect equitable outcomes. And so we need to think much more clearly and carefully about how to anticipate and address racial disparities in the effects of these laws. And finally, I think a really important takeaway here is that these laws are hard to study well, and this goes really for many of the laws that we and policies that we're interested in the context of the overdose crisis. So we need to think really carefully about what methods we're using in order to tease out the real causal pathways at play. In our next steps, we're going to start by taking the study that I presented today and doing an urban-only comparison, because many of the Black folks who are in the mortality data are concentrated in Ohio, are concentrated in urban areas, whereas the white folks are more spread out between rural and urban areas. So we could be confounding urbanicity with race here, and that it's possible that that could be explaining some of the differential results we see in Ohio. We're also getting ready to launch a pilot study in New York City using mixed methods to understand much more deeply people's decision-making process at overdose events and whether they call 911, and then how those decision processes vary by race, possibly illuminating mechanisms that might underlie racial disparities in the effects of Good Samaritan laws. And finally, we'd like to do a study examining this same general framework, whether Good Samaritan laws benefit white people more than Black people, but using the outcome of 911 calling, which is a more proximal outcome than overdose mortality. So thanks so much, and I look forward to discussing.